There are always risks with any surgical procedure. Research shows even small drops in body core temperature, as small as 0.5 degrees Celsius below the normal 37 degrees Celsius, may be associated with negative clinical outcomes. Unintended or unplanned perioperative hyperthermia, defined as a core temperature below 36 degrees Celsius or 96.8 degrees Fahrenheit, is one of the most common complications associated with surgical intervention, with an incidence of up to 20%. Avoidance of inadvertent hypothermia is a crucial quality performance measure, optimizing efficiency and improving the care of surgical patients. Patients who develop hypothermia may experience a number of complications. Hypothermia impairs the immune system, causing vasoconstriction. Studies link this with a threefold increase in the risk of surgical site infections for certain surgeries. Postoperative shivering and increased recovery times are common with hypothermia. As body core temperature decreases, blood pressure and heart rate rise, increasing the risk of adverse cardiac events. Blood coagulation is also inhibited, which leads to an increase in blood loss. Each year, there are an estimated 250,000 surgical site infections, resulting in an increase in patient stay and a total cost of billions to our healthcare system. There are several contributing factors we have to work around: anesthesia, patient age, and underlying medical condition and surgical procedure type. But there are crucial factors that not only can be controlled, but can also positively affect those that can't, such as the cold environment of the OR, infusion of cold fluids, and use of cold irrigation fluids. Prevention of hypothermia has clear benefits for patient health and well-being, but there are just as compelling advantages for healthcare providers in reduced costs and faster recovery times. By preventing hypothermia, there is a 64% decrease in the risk of surgical site infections. Actively warming throughout perioperative care improves patients' outcomes, allows them to experience a greater level of comfort, avoids postoperative shivering, and can help patients remain calmer before and after surgery. Cold irrigation solutions placed into surgical sites enhance heat transfer from the body core to the solution and increase heat loss. According to AORN, warm irrigation solutions to be used inside the abdomen, pelvis, or thorax should be considered. Warmed irrigation fluid near 37 degrees Celsius should be used. When using warmed irrigation solutions, the temperature of the solution should be measured with the thermometer at the point of use and verified before installation. Irrigating with hot solutions has resulted in patient injuries. The conventional practice of using a cabinet warmer to heat saline bottles poses several challenges. Warmed saline from a bottle cools down quickly below body temperature as soon as it is poured into a basin in as little as 7 minutes. The cabinets may be set at a much higher temperature than the fluid needs to be, requiring manual monitoring to prevent overheating. Pulling saline bottles from warming cabinets during a procedure can be disruptive. Also, the time to label and rotate saline inventory and monitor temperatures in a warming cabinet is not an efficient use of nursing resources and leads to error and wasted time. With an Ecolab fluid warming system, a room temperature saline bottle is poured into the system basin and provides warm irrigation fluid at a visible and controlled temperature for immediate access in the OR. Maintaining normothermia improves patients' outcomes, allowing them to experience a greater level of comfort and shorter hospital stays. Make sure that an irrigation fluid warming system, along with active patient warming and warmed IV fluid, is part of your hypothermia prevention program. In addition to irrigation fluid warming systems, Ecolab offers a sterile surgical slush system called Hush Slush and a solution for scope warming to keep scope lenses warm to prevent lens fogging during surgery. With Ecolab's comprehensive approach to temperature management, backed by the personal service and support you've come to expect, you can be confident that you are using the most advanced technology for patient warming and implementing the latest best practices to help reduce the risk of hypothermia.